What a crowd.
Ladies and gentlemen, our honorable guests, to all of those who are following us on social media, good evening and welcome. Welcome to another UN talk that we are organizing this year under the UN Socio-Economic Response to COVID-19, which is this time under the title, Together We Stand with Women and Girls to Build a Safe Environment from Violence, to reflect on the social impact of COVID-19 on women and girls in Jordan. Before we start, allow me to kindly ask our guests in the room to put their mobiles on silent, please. Today's UN talk is very special, as we have a guest representing UNFPA Global, who is on a mission visiting different countries in the region. And today, we are glad and honored to have you here with us in Jordan. So welcome, Mr. Peterson.
Thank you.
Deputy Executive Director of Management of UNFPA, and thank you for being with us today. We look forward to hearing from you in this talk on your impressions from your visit to Jordan. Our talk today will also include a session with key stakeholders from the government of Jordan and representatives from leading national non-governmental organizations and civil society organizations in Jordan, who will tackle the national efforts to respond to the impact of COVID-19 on women and girls, with focus on gender-based violence. Before we start a briefing with Mr. Ebb on his visit, allow me to welcome Mr. Anders Peterson, UN Resident and Humanitarian Coordinator in Jordan, and Ms. Inshirah Ahmed, UNFPA Head of Office in Jordan. As we all know, COVID-19 pandemic is having its impact on all aspects of our lives, not only our health and well-being. One of these main aspects in the social impact on women and girls, and specifically the increase of violence against women and girls during and post the pandemic. And based on a UNFPA risk assessment conducted during the pandemic, 69% of all survey respondents and informants advising of increasing prevalence of violence. The UN, in coordination with the government of Jordan and partners, have been, and since the onset of the crisis, responding to this impact towards building better forward. And I would like here to refer to the UN Secretary General's quote, who said, "The crisis is exposing the inequalities of our societies." With this statement, allow me to invite Mr. Anders to brief us on the social impact of COVID-19 on women and girls in Jordan and how the UN came together to respond to the crisis in general.
Thank you. Thank you so much, Khada. It's really an honor and a pleasure to be on the podium here today and to address all of you that are watching us on your screens, as so many of us have done for so long, but also some actually colleagues here in the room, together with my senior colleagues of the UN family, of course, from New York. So really a great pleasure to have you here in Jordan with us. And of course, it's always my dearest colleague from the UN family, the head of UNFPA. We work on this all together. Look, I think it's a little bit of an understatement to say that the last 16 months have been like absolutely no other. I think each and everybody, and of course all of us here in the room and all of you that are watching us, you will have experienced the same thing. It has basically turned our lives upside down. But I also think it's fair to say that as much as we have been primarily, in a way, we have been facing the health impact. We've been speaking about how many ICU places can we come up with, how have we been able to really respond to the immediate needs that are on our lives. What we are seeing today is the secondary impact. It's about the socio-economic impact of the crisis. And I think it's fair to say that's what's hitting us now. And among those that have been mostly hit, and unfortunately can expect to be the most hit, are precisely the women. And I think within those, of course, younger women. And I think that's very much what we would like to talk about today. It's like a shadow pandemic. It's a second pandemic. It's the invisible pandemic, but really what is at the face of most people when they start feeling that they're losing their livelihoods, the basic income potential. But I think that is also true to say that this impact is something that we will have and that will be with us for the foreseeable future. The Secretary General of the United Nations has repeatedly said that in less than a year, we have seen decades of development simply evaporate, simply go away. And as dramatic as they may sound, it's actually the truth. And that, of course, goes for Jordan as well, despite the fact that Jordan has actually done much better, relatively speaking, than so many other countries in the world. So really what we're facing today is a situation at which COVID has exacerbated the key risk factors for gender-based violence. Globally, we see, and of course here in Jordan as well, an absolutely alarming increase in multiple forms of violence against women and girls. Physical, psychological, sexual, and economic forms of domestic violence that has been fueled by the harsh environment that you have been finding within the households, with food insecurity and the confined living conditions when we've been asking people to stay at home, and rightly so, but suddenly in very small spaces where you may argue that it's almost unavoidable that you will see some of those risks being exacerbated. But simultaneously, of course, here in Jordan, we've also seen, as all over the world, with the school closures and with the financial and food insecurity that have heightened further the risk of violence for girls, including sexual exploitation, harassment, and child marriage. And I think we see the statistics, Ensra, across the country, across the kingdom, and facing something that we just have to find a way to address. Now, we also unfortunately see numbers of reports coming out of increased sexual abuse and harassment. And important, I think, to say, it's both online and offline. So it's not something that just happens, so to speak, in between people physically, but it's actually happened online as well. And in some situations, even increased in femicides. As we clearly saw in the Secretary General's report on the socio-economic impact of the pandemic, this is in no way just a public health crisis, but humanity is running a risk, as I said, to reverse decades of development. And I think it's nothing less than this. This is really what we're facing today. So we're in Jordan. I will leave this very much to you, Ensra, to speak about the specificities of what we actually are doing. But I think that, of course, we as the United Nations, we have done our level best to try to respond to and to partner with the large international community and together with the government to really address those challenges that we're facing. And I think it's interesting that we just come from a meeting with the Minister of MOPIC, the Planning Minister, Minister Nasser Schreider. And Mr. Peterson was, of course, leading us in that conversation. But once again, I had the opportunity to really underline what we believe as the United Nations is an absolute imperative that not only do we have to address the immediate economic impact of the crisis, and very rightly so, together with all our partners, but if we don't simultaneously address the root causes and the socio-economic dimensions of this, the crisis and the opportunities to recover will take much longer. And I think that's extremely important that we all together, and of course we as a UN family, we will be with the government and with all our partners in this endeavor. But let me end just by saying that I think there are two things we really have to take into account here and that we really have to focus on very particularly. And that's the centrality of engaging women. And I think that, many in this room can speak to this much better than I can, but there are two things that really stands out for me in this regard. And it's not only because it's a question about rights, it's not only because it's a question about equality, but it's a question about it's actually the right thing to do in order for us to recover better from the pandemic. Number one is the level of participation. We just have to get women's participation in decision making throughout into the space where it should be. And we know for a fact, and with all due respect to all men in the room, including myself, women are much, much better equipped and much, much better positioned to secure that the socio-economic dimensions of a crisis are fully taken into account. It's simply the way it has proven to be. Rightly or wrongly, but it's a fact that we have to take fully into account. The second dimension of this, very much for me, is the question about voice. And we need simply more of the female voices in this debate that actually are at the table when we make decisions on how we're going to take us together forward in what we in the United Nations call the Building Forward Better dialogue. So really, if we get the participation right, if we get the inclusion right, and if we get the voices out there, I think there are an abundance of proof that will tell us that we have better opportunities to recover from the pandemic. So really, we are at a critical stage in our development, including here in Jordan, and I think that at the same time we have the opportunities, but only together we can really take the action needed. And that's, of course, I'm so happy that I'm here together with my senior colleagues from the UN in New York, with Ansha from UNFPA, and behind me I have the full UN family. So thank you so much for coming here today.
Thank you so much, Mr. Anders. Now, from what you said, the UN in Jordan has expanded and increased their efforts towards responding to the impacts of this pandemic, which brings us to the question to Ms. Inshirah Ahmed, UNFPA, Jordan's head of office. As a leading UN agency in Jordan in responding and preventing violence against women and girls, what has and is UNFPA doing to counter that and support survivors?
Thank you so much, Ghada, for this timely needed question, though we repeat it many times, but I think it's very important for us to repeat it and try to answer it together with partners, to find a solution. If we really wanted to go more forward and get back better, we really have to answer these crucial kind of questions. But before I do that, let me welcome my senior colleague, the Deputy of the Executive Director of UNFPA to Jordan. So welcome again, Mr. Ip. And I also have a privilege to always work with the RC, Mr. Anderson here in Jordan. So for your question, let me go back. As I said, for us in UNFPA, we cannot do it alone. And what we need and what we are working towards is to have a meaningful partnership. And this partnership, it goes from the level of the decision makers, the governments, through the level of civil society, as well as the community at large. We as UNFPA, as other UN agencies, we work with nationals as well as with refugees. And as you know, the magnitude of the problem of refugees in Jordan, the huge number of refugees and the kind of multiple challenges that the refugees face in a country like Jordan. For us, let us today just focus, for the sake of this limitation of time, and the topic today is the GBV. For us, we work on two folds. The most important one for us is the protection. So Ghada, if you're not doing protection, you cannot wait for the crime to happen and then respond. We are more proactive. And I think this is not only for UNFPA, it's many partners, in our programming, in our policy dialogues with the government, with decision makers. We always put this in the table, that we really have to be proactive and we really have to work on the issues of protection. And as far as I'm concerned, I think protection is far more important than response. So let us agree on that. Actually, the important thing when it comes to protection is the engagement of the very people that you wanted to protect. So it's very important to listen to the voices of the women, adolescent girls. Those could be national, those could be refugees. And this could come through their civil society organization, and as well as individuals, because we have the outreach teams that goes and meet with different people. I am not saying that we are reaching everybody. This is not happening, but this is the goal. This is what we are working towards. And I hope that with the help and with the support of the partners, we will be able to do that. So this is number one. Number two, when it comes to response, what we have done during the COVID-19, we managed, luckily, to shift in many ways our kind of the intervention modalities to mobile clinics, for example, hotlines, and this helped a lot. Instead of the women and the girls to actually have the access to these centers, to these clinics, which were not working during the lockdown, during the restrictions. We managed to bring these mobile clinics to them at home, and we managed to connect them with the service providers through the hotlines. I am not saying that this is perfect, but this is what we attempted to do, and I hope with the help and with the support of our donors and our partners, we managed to scale up and we managed to sustain what we are doing. There are other services that we managed to work on, for example, the CMR, which is the clinical management of rape, to make sure that we're strengthening what we are doing in terms of the case management. I don't want to talk much, Ghada, but I wanted to kind of encourage everybody, particularly those listeners online, please download the application of Amali. I think this is very important. You will get the information about the services when it comes to gender-based violence, when it comes to the services available in your area. It is vital to have this in your mobile, particularly for young women. So I don't want to do much on that, but thank you so much for giving us this opportunity, and I hope that we listen more from our partners, the national partners.
Hopefully. Thank you so much,
thank
Ms.
you.
Inshirah. Thank you. Now, Mr. Ebb, allow me to welcome you again in Jordan, and indeed, traveling during this crisis is not easy, but you made it. Now, can you brief us about your visit and what are your impressions about services provided to GBV survivors in Jordan?
Thank you very much. This is indeed a pleasure to be able to travel again. I've waited for that since I joined UNFPA last year in September. Now it's possible. And so enriching for a person like me working in headquarters to get out and talk to people on the ground, colleagues. Thank Isra and her team for the work they're doing, and Anders also for the work they're doing here, and all the partners. But first and foremost, the women and the young girls, and also the young men that we are reaching out to in our programs together with partners. And in that respect, even though I'm here for only a few days, but I really have gotten a very strong impression from the activities, also from the commitment of the government. I met with the Minister of Youth, the Minister of Planning, and the chair of the National Population Council. There's no doubt that the issues that UNFPA in particular are focusing on, family health, sexual reproductive health, empowering young people, and the population dynamics, so to speak, are high on the agenda with the government. So we are ready as a partner to that. But I do think that when it comes to gender-based violence, I have met both here in Amman with the Amman Family Health Center, I think it's called, which serves both refugee women, but also everybody else coming to the clinic. And later on, we have been in the Satari camp and seen some of the centers there that we are working. I think what is important, and we saw that this morning at the center here in Amman, is to have a comprehensive approach. And what does that mean when you have a woman who has been subject and is a victim of violence? It means that you not only look at, so to speak, the medical part of it, is she injured and does she need some medical clearance and so on. You also look at and get an impression, trying to assist and find out what is behind this, and can we counsel in any way? Is there a need for legal counseling, or is there a need for family counseling, or is there a need for getting together with other women and have that? And that's what we're trying to support, and I think that what we saw today, it's so important when we are talking about gender-based violence, because it's a complicated matter, and we need to address it in a comprehensive way. And I could just mention that I met with a group of women who were Syrian refugees who had been part of a counseling training or you know, offer for where they got some counseling on how to think about the situation, how to improve their situation. And they were at the end of this, I think there were 8 sessions all in all. So I asked them, what did you get out of that? And I got a lot more self-confidence. One thing they mentioned, we got the advice to demand in our family that I should be able, and I will have, I request to have an hour a day for myself, where I can focus on myself and my needs and so on. And you could see in these women, they were energized by that, and they had, you know, they had managed to get that through as a result. So I think that was extremely good. And a very good response there also was that they were now at the end of this training, but they were ready to continue as a group, support each other in you know, raising their self-confidence, in raising the issues that they were facing, and seeking that. So I think that was heartening, first of all, but it was also, I think, a clear sign of the right approach. So we need to be open for these different aspects.
So, Mr. Ebb, based on your experience and as we are tackling today the social impact on women and girls, can you please share with us some of the global best practices that would help to mitigate the social impact of COVID-19, which Jordan can benefit from?
Yeah, I would say one of the most important experiences is exactly, it's good that you're asking for, you're phrasing it, the social impact, because it is to address this as a multiple dimensional social issue when we look at why is it that women and girls are proportionately higher, much harder hit by this crisis. It's not just a health crisis, it's not just an economic crisis, it is an economic crisis, it is a health crisis, people are dying if they're not vaccinated, if they're not treated. But it reflects also the you can say the cultural structures that are in different societies, and that's why we need to address it in a comprehensive manner. We need to involve the women in addressing those needs. And one thing also, a couple of other things, but seen from our side, from UNFPA, when I came to UNFPA last year in September, we were already talking about that this crisis is hitting women and girls much harder than others. And I asked my colleagues, do we know that for sure? Do we have the data for that? Or is it something we are assuming because somehow we are getting different stories? And they looked me in the eye and said, we have the data, and we have even better data now. And it just tells us also that data is so important when we have to address. And sometimes it's considered a bit of a technical issue, and we need to get some vaccines out, and we need to do this and that. But we also always need to focus on monitoring, getting the data for how is the situation, what are the challenges that women and girls are meeting, because it helps government and partners in addressing these issues. So that's one important part, I think. And then an important lesson is also, this is a rights issue. This is an issue about non-discrimination. It's about ensuring women and girls their rights, even in times where resources are small and so on. And then from our side in UNFPA, of course also together with the rest of the UN family and other partners, it is the time for strong advocacy, for having the strong, close contact with governments, and telling them, we know you have hard choices when it comes to resources, when it comes to addressing this, but we also know that if you cut down on resources for family or reproductive health matters, for family planning, maternal health, it's gonna be much, much worse in the longer run than if you make that investment now, if you preserve that investment now. So we already now have some frightening figures, and unfortunately I cannot give it, but the fear of this increase in gender-based violence, how many millions more unwanted pregnancies this will lead to. And that then adds into how many million young girls probably will not be able to fulfill their education because they will have to drop out of school because they become pregnant. And that relates then into what a missed opportunity for society there. So it all relates. It is a long-term investment. It's difficult to really focus on when you have a very short-term threat, but we just need to do it.
Well, thank you so much, Mr. Ebb. Mr. Andres and Ms. Inshirah, thank you so much for enriching today's discussion. Now we will give the chance to journalists to ask questions to our speakers.
مرحبا، أحكام الدجاني من موقع سعودي في الإخباري. سؤال لمستر إيب بخصوص مخرجاته عن وانطباعاته مما رأى في الأردن.
Can you repeat the question again? ممكن تعيدي السؤال, please?
مخرجات وانطباعات مستر إيب من وجوده بالأردن.
About women in Jordan?
من زياراتك.
Your visits.
Yeah, thanks. Well, my impressions are that, to be frank and open, this is clearly a society where there are many barriers for women still to enjoy the same kind of opportunities as men. And this is something that we from UNFPA, again, are particularly focused on what it means in terms of women's and young girls, adolescent girls, possibilities for deciding themselves, for instance, when to have kids, when to, and to make a choice for an education, and to use that education, because I also learned, for instance, that many young women are getting education and higher education, but then they are married and then they disappear from the labor market. And is that a choice? Maybe, I don't know, but is it seen from a Jordanian society good development? No, we are losing out on many that could contribute to the country. So we are here to assist, provide good advice on how we can address that. All experience shows that if, as I said before, women are given the choice to decide themselves, that is indeed the way ahead. Another impression, and that I think I mentioned it before, strong commitment from the government, and I think that's been very encouraging. We had a couple of years ago in Nairobi a big summit where we celebrated the 25th anniversary of the UN Conference on Population and Development, where there was an action plan decided in order to reach some of these goals that I mentioned before. And Jordan was participated in that conference, made some strong commitments on how the government of Jordan will work to implement and reach the targets of that convention, which are, the ICPD plan of action, as it is called, about population and development. The breakthrough at that point in that conference was that all member states and UN and participants agreed it's not a question of governments deciding now we want to steer the population development in this and this direction. It's a question of the rights of the individual woman and girl to make their choices themselves. And it's a question of governments making sure that there are no barriers to health services, to maternal health services, to education, and so on. And I'm just, encouraged as a staff member of UNFPA that listening to the government saying we made these commitments, we are fully committed to work for them to the benefit of the Jordanese women and girls, but all in Jordan.
Okay.
أسأل السيد إب بيترسون، هو له جولة إقليمية كانت في المنطقة لحتى متابعة القضايا السكانية والخدمات اللي بيقدمها صندوق الأمم المتحدة للسكان. فشو المقارنة اللي ممكن إنه إحنا نعملها، إنه الأردن وين مكانه في الإقليم خلال استجابته للجائحة، وخصوصاً فيما يتعلق بالخدمات الصحة الجنسية والإنجابية، قديش تأثرت؟ وهل هناك في توجه لصندوق الأمم المتحدة للسكان للمنطقة العربية أو المناطق يعني الأخرى، إنه يكون في هناك زيادة للتمويل للخدمات الصحية والجنسية والإنجابية وغيرها، أو العنف المبني على النوع الاجتماعي، خصوصاً إنه كان تأثيرات من خلال الدراسات التمهيدية إنه بيّنت إنه النساء والفتيات كانوا الأكثر تأثراً من النواحي الاجتماعية والاقتصادية خلال الجائحة. وشكراً.
Thanks. Yeah, it's been quite interesting. I visited 3 countries in the region, a number of similarities. All have, of course, been hit by the pandemic. All have a huge share of youth in their population. And also, all have also, you can see some what I mentioned before, the barrier for women and girls are prevalent in all of the 3 countries. On the other hand, there are differences, of course. Iraq facing their challenges in terms of the conflict coming out of crisis. Egypt also, all are facing economic problems because of that. And all are actually facing the fact that you mentioned that women and girls are, GBV has increased during that. So I think it's important to, in addressing that, and that's something that we really underline from our side, from UNFPA side, that the response to these crises has to be country specific. So we're not necessarily giving all the same advice to the government of Egypt as we do to Jordan. And again, I think the high share, I mean, Jordan, different. I think they have, but it's difficult to compare, of course. But Jordan has done quite well in addressing the pandemic, quite well, I think. But it doesn't mean that we don't see the same consequences and social impact on Jordan. Is, even though there are many challenges, but it's a much more stable country, you can say, clearly than Iraq, and that gives some possibilities and a platform to work on, of course. So there are these differences, and we need to again be at our toes to provide the best advice to these governments. We base our advice on knowledge, and of course we can give it, that there are things that can be learned from others. I will, in this respect, just mention that UNFPA here, that we are here in Jordan publishing what we call our knowledge management series of publications, which are actually drawing on the lessons from the region, from different countries, in order to address some of these issues, exactly in terms of GBV, access to family health clinics and so on, and how we should address. So we are trying our best to address these issues and to assist our partners in meeting these challenges. Again, I think one of the major challenges for Jordan, for the 2 other countries as well, the high share of the youth in the population, in a situation where the economic situation is really, really difficult. The best thing to address, I mean, we are talking about the and we insist on talking about the demographic dividend, because having a large share of youth in your population is an opportunity for a country. But it's also clear that circumstances right now are very difficult, because the best thing to do for youth is to ensure that they have a healthy life, and that means also, in particular for the young girls, that they have rights, as I said before, for reproductive health and family planning. Provide them an education, provide with employment. That's the best way to address this issue, and it's very, very difficult right now. But I met the Minister of Planning. He's clearly focused on that issue, and we will do within our mandate. We cannot do it alone, and that's also good. Anders is here. There are other UN agencies that are taking care of some of the other aspects when it comes to employment creation and so on, and there are other partners here.
Well, Mr. Ebb, we can't agree more, of course. And I would like to thank you once again. Thank you, Mr. Anders and Ms. Inshirah, for being with us today. Now, ladies and gentlemen, before we go to our next session, we will leave you with a video about the UNFPA Jordan's work response to GBV. So stay tuned. We'll be back in 5 minutes.
We're done.
نحن بصندوق الأمم المتحدة للسكان عالمياً مهتمين بإنجاز 3 أصفار بحلول 2030. الصفر الأول فيما يخص وفيات الأمهات، الصفر الثاني فيما يخص الحاجة الغير ملباة بالنسبة لوسائل تنظيم الأسرة، والصفر الثالث حول العنف القائم على النوع الاجتماعي، وهذا محور شغلنا بالمملكة الأردنية الهاشمية. ونحن نعمل في تجانس مع شركاء محليين أساسيين بما فيهم الحكومة الأردنية وشركاء آخرين. نحن نعمل على تنفيذ الحزمة الأساسية بالنسبة للنساء والفتيات الناجيات من العنف، ونعمل على جودة الخدمات، ونعمل بالتنسيق مع قطاعات مختلفة مثل قطاع الصحة والخدمات الاجتماعية والعدالة والشرطة. نحن في صندوق الأمم المتحدة للسكان كبقية منظمات الأمم المتحدة نعمل على أن لا تتخلف امرأة أو فتاة عن الرقب بحلول 2030.
الشراكة مع صندوق الأمم المتحدة للسكان شراكة استراتيجية. نقوم حالياً على وضع خطة وطنية لحزمة الخدمات الأساسية لمناهضة العنف المبني على النوع الاجتماعي، وأيضاً متابعة الخطة الوطنية لزواج الأطفال من هم دون 18 عام. أيضاً مع صندوق الأمم المتحدة للسكان نقوم على تعزيز دور الفريق الوطني لحماية الأسرة من العنف اللي بترأسه المجلس. الهدف زيادة مستوى التنسيق وتعزيز منظومة حماية الأسرة في الأردن.
إن الاستجابة للعنف ضد النساء والفتيات من خلال خدمات صحية عالية الجودة أمر في غاية الأهمية، وذلك لضمان تقديم خدمات في أعلى معايير الصحة للناجيات. تركز الشراكة الاستراتيجية بين صندوق الأمم المتحدة للسكان ووزارة الصحة على تعزيز القدرات الوطنية للاستجابة للعنف المبني على النوع الاجتماعي من خلال برامج بناء القدرات لمقدمين الرعاية وتقديم خدمات المعالجة السريرية لحالات الاغتصاب. دعم تطوير دليل الإجراءات الداخلية لوزارة الصحة للتعامل مع حالات العنف المبني على النوع الاجتماعي بما يتماشى مع السياسات والمبادئ التوجيهية الوطنية للوقاية والاستجابة للحالات العنف في الأردن.
on women. I apologize for that. Welcome again, ladies and gentlemen, to the panel discussion on the social impact of COVID-19 on women and girls in Jordan. In this second round, we are very humbled to sit with key national representatives from the Government of Jordan and leading NGOs and civil society organizations in Jordan. Without further ado, allow me to welcome our experts in this session. Dr. Salman Nimes, Secretary General of the Jordanian National Commission for Women. Dr. Ibrahim Aql, Director of Institute for Family Health, Noor Al Hussein Foundation, and Dr. Abdel Amawi, Secretary General of the Higher Population Council. Dr. Salman Nimes, hello, good evening. Well, one of the main strategic objectives that the National Women's Strategy 2020-2025 focuses on is ensuring that women and girls live a life free of violence. As the Women Missionary in Jordan, how are you facilitating the achievements of this strategic objective despite the challenges that COVID-19 initiated? And do you think that the needs of women and girls survivors of violence are the front of the Jordanian government's agenda?
Thank you so much for this opportunity. Of course, as you know, Jordan adopted the government of Jordan adopted the National Strategy for Women on the fringe of the lockdown. It was on the 8th of March of 2020. So basically, we didn't have enough time to start working and implementing at the time. But immediately what we started working on, and with the support of UN Women, and that was very important, is carrying out an addendum that takes into account the impact of COVID-19 on the four main outcomes of the strategy and on the priorities that we should be working on the following 2 years, because we started working on the executive plans with the government. So, and as you know, the National Women's Strategy for Women, one of its main objectives is ending violence on gender-based violence on girls and women in Jordan. So this is really one of our main areas of work. So, and this is very important because as you know, the Jordanian National Commission for Women is not a service provider. And what is important for us is how do we work through all our partnerships at the multi-levels to ensure that we are advancing this agenda and the services that are provided. At the outset of the lockdown, and it was mentioned before, and we know that this is something that has happened to the entire world, we know that, and for Jordan, the first couple of weeks, we had a few glitches as we were not yet ready to work online and to, as you know, that being able to, for the civil society to move freely with the limitations of movement. But I have to say that the Family Protection Department stepped up its services, put more police women on the ground, and their cars and all their services tried to make up for what the civil society was supposed to do, including transportation of women, and that was very important. And we worked with them to ensure that although JNCW does not have a real hotline in comparison to other civil society organizations, but we made sure that we are all working together in order for these voices, for women cases to be moved forward. We met immediately within the following couple of weeks with the support of UN Women with the Interministerial Committee to raise the issues. We had the civil society organizations in the meetings to raise the issues that are very important in order to respond to that. And one of the issues that we mentioned, and I remember I followed it up in a meeting with the Gender Partners Coordination Group, is that the in-kind packages that were given to the poor people and the people who are in local communities did not take into consideration the reproductive health needs and the hygiene needs for women. And those definitely they don't have a storage, they don't have more of the material, they buy it month by month according to their income. And that was one of the issues that we raised, and I remember UNFPA immediately took up this recommendation and helped us through it. We also continued, and of course, the national team. We work with the national team, which I am, proud to be. My colleagues here are represented here, in addition to a big representation of the government, the services, and the civil society. We started meeting online to deal with immediate issues. On the other level, JNCW has to work on ensuring that there is enough research, policy making relating to gender-based violence. We had already started programs that are working on positive masculinity, working on supporting the implementation of the plan of ending child marriage, and we knew and we pushed that child marriage will be increasing because of the closure of schools, no access to internet. We know the poorer areas do not have enough smartphones, and so we expected that closures of schools and online studying will contribute to the increase of child marriage, and that's exactly what happened. So now we have also partnerships that had started with UNFPA, and now we're continuing to work on them, and we're expecting that they will have important impact on planning and response and services. This includes a program that is jointly funded by UN Women, UNFPA, ASQA, and we're getting also support from the Cypriot government through MOPIC to carry out the costing of violence, domestic violence, which will contribute to policy making. We're also working on looking at the impacts and the processes for reporting, and how, that mandatory reporting is a very controversial issue that is being discussed in Jordan. We have different views, but we need to ensure that once you report, you are able to get all the services in the loop, so you are not endangered. So this is a very important area that we want to continue to work on. Now, as for the government of Jordan, I think I would say that when it comes to the position of the government of Jordan, of course, there is a decision that we need to end this. And there is a commitment, but how do we realize this commitment with all the complexities around it? How do we deal with the attitudes? How do we deal with how sometimes social norms are reflected on the huge number of service providers within this whole loop? Is not that easy. But I want to say that, for example, the Family Protection Department has also stepped up and is now working on improving its services, and it's working with the support of the UN system to improve their services. But my question is still today to the government of Jordan, how can we, in the end, the women, yesterday I called the Family Protection Department, within 5 minutes they were at the place of the woman that was, I expected she needed help. But the question is, how do we deal with them after that? Are they going to stay in a shelter for a couple of months and then deal with her as a property of the family? And
That's a good question.
Yeah, and then she has to be sent back to them. This is a question because it's about the mentality behind the legislation, the procedures, those who are implementing the services. We are still a long way from giving these women a survival-centered approach where we do not get into the negotiated power relations and positioning about that. We're supposed to give them the protection, and they need to feel that they are able to continue their life with dignity after they move away from violence.
Absolutely.
Thank you.
100%. So thank you so much, Dr. Salma. Now, Dr. Ibrahim Aqil, as it was highlighted before in the discussion with Dr. Salma, numbers have shown that violence against women and girls in incidents have increased during COVID-19. As the director of one of the main NGOs providing services for survivors of violence in Jordan, and as a member of the national team for family protection, can you please tell us what was your role in responding to the increased number of violence incidents during COVID-19, and how did you ensure the continuation of high quality service provision despite the challenges that COVID-19 added in front of service providers and survivors of violence?
Thank you, Ghada, for this question, and thank you, Salma, for the introduction and the overall response to the first question, which also lead to the second question about the role. So your question is have two parts. One part of the question is related to being a member of the national team for family protection, and how did the national team responded to the escalating domestic violence and the escalating violence against women during the pandemic. And in this regard, we all know that the best statistics showed that there was an increase of 30 to 35% of the gender-based violence and violence against women during the pandemic time and during the 2020. As a response for that, there were so many issues that the National Family Protection Team, and my colleagues here are also members in this team, have responded to. There were 5 dimensions that the response of the family protection team, the National Family Protection Team, responded to. One was related to advocacy, where the team led an advocacy campaigns and meetings with the government institutions and with the government actors to make sure that the response continues to be there, continues to respond to the increasing numbers of violence against women. On the other hand, there was a role of leading the awareness during the pandemic. Last year, the 16 days campaign was led by the National Family Protection Team with participation of all the government and semi-government plus the NGO sector. On the other hand, there were some efforts related to coordination, as Dr. Salma mentioned, with the FPD, the Family Protection Department, the security services, with other NGOs, with legal service providers, and with different actors on the ground. There were some roles related also to developing. The national team is currently in the process, and it's almost finished, developing the national SOPs for responding to gender-based violence and violence against women and children. So all these efforts were accumulated and led to a good response from my point of view from the National Protection Team to the pandemic. On the other side, which is the second part of the question, how did the IFH, the Institute for Family Health of King Hussein Foundation, which is one of the national NGOs responding to GBV in Jordan, the response was really splitted into different levels. On the first level, the response side. The response side, the Institute for Family Health established immediately, just when the curfew started and the lockdown started, established helplines and hotlines to respond to the needs of the women and adolescents, girls, when it comes to GBV. Those helplines and hotlines were working 24/7. And we were coordinating also with other service providers, with the Family Protection Department and other service providers in this regard. We've managed to establish a remote case management for GBV cases and to build the capacity of the IFH staff, of the Institute for Family Health staff, and service providers to be able to provide the remote case management services. We were also able to maintain some emergency and critical services during the lockdown. The clinical management of rape hotlines and response and service provision was maintained during the lockdown. We've also responded to, because most of the primary healthcare or all the primary healthcare centers in Jordan were closed during the lockdown. So the IFH maintained also mobile teams to where they were able to provide the contraceptives, the family planning commodities, during also the lockdown for women in need, and sanitation also services. We were able to work with volunteers from both the host community and the refugee community to reach out to women in need and girls in need in this regard. We were also able to coordinate with different partners our activities and refer to the Family Protection Department, refer to other services, legal services, shelter services from colleagues. So this was, in a nutshell, what we've been able to provide during the pandemic.
Thank you so much, Dr. Ibrahim. Now, Dr. Abla Amawi, hello. How are you? So, Dr. Abla, young girls in Jordan can be a great asset and potential for development in Jordan, yet they face many challenges to reach their potential, and COVID-19 added another layer to the challenge, increasing adolescent girls' marginalization, especially in refugee camps and rural areas. Now, what are your recommendations to ensure we don't leave young girls behind and we capitalize on them as positive agents of change?
Thank you, and I thank UNFPA for putting this team together. I think we cannot speak of adolescent girls in isolation as if they are on Mars without actually contextualizing it within the whole spectrum of gender and gender relations in the country, gender status. So that's my first point, that if we look, Jordan has done great progress in various aspects as it relates to indicators relating to women, but at the same time we lag so much behind in terms of the gender gap report, in terms of women's economic participation, which is less than 15%, unemployment among women. Also, their political participation is symbolic as far as I'm concerned. And also, if you look at social norms and how they are enshrined within the curricula, within the different laws that remain discriminatory. So this is the first point. The second point, if we want to discuss adolescent girls, we have to look also at the intersectionality among women. So what do we mean by that? That an urban Jordanian woman or adolescent girl has different challenges than a refugee woman or a poor woman or adolescent girl. So we have to look at which type of women are we looking at within the spectrum of religion, poverty, urban, rural, income levels, and economic status, refugee status, or national status. And through that, we can see the whole, the differences in the challenges presented and the depth of the incidence of those challenges. So a poor adolescent girl in an urban setting that is Jordanian has challenges, definitely. But how are they magnified when the same girl is sitting in a refugee camp without access to services, without access to opportunities, without access to education or health? So this is my second point. The third point is that the population target we're looking at is about 21% of all women, those between the age of 10 and 19. Women are about 47% of the population. Of those 47, 21 are the age group that you are looking at. So if we're looking at the challenges of this age group in particular, they are suffering from. One is that Jordan made progress in education, but there is a great deal of dropout among this age group, and that dropout leads them mostly to leave at the grade 10, and they get into child marriage. Secondly, poverty, as it affects the entire poor, yet at the same time, its impact is felt at the family level for adolescent girls, and that's why we're seeing an increase in child marriages among this age group. Thirdly, gender-based violence, which my friends and colleagues discussed, and its impact on these girls is that they lack the awareness to how to resist, how to address it, and they lack the legal awareness of where to go for services. And within that as well is that we see inequality in terms of, or inequality in terms of access to sexual and reproductive health services. between regions, between geographical areas, between income levels across the Jordan, which means that those girls do not have access to services to begin with, whether they are adults or adolescents. The final point is in terms of how the pandemic, how the COVID response, how did it affect them? As was mentioned by all the speakers, it affected the entire population. However, the intersectionality matters, the socio-economic and political status matters, but what we have seen in terms of the response, as Dr. Selma has mentioned, in the beginning, there were glitches. For me, Jordan as a government has done a very good response and reacted very well. Like the rest of the world, it was surprised. At the same time, for us at the Higher Population Council, and we are very thankful for our partnership with UNFPA, we were able to zoom into how can we provide protection for the different target groups. And I think with Dr. Ibrahim and Dr. Selma, we really try to highlight that this is a major issue in any response crisis. After you have the response, you're panicking. As a human being, as a government, it's the same response globally. But once you go through that shock, then you have to care for those that need protection, vulnerable groups, and among those were the adolescent girls that didn't have access to services, didn't have access to awareness or advocacy or any of that. So this is one of the key issues that we focus on. Where do we go from here? And how can we address the various issues we mentioned? One is that we really need to not only highlight the challenges and the root causes, but how can we have a concerted effort to address issues of dropout from school, gender-based violence, and criminalize it, and as well as harassment, which really deters many families, especially among the refugee communities, from sending their girls to school. And we hear always, and with this sad note I will end, is that we married her off because we're so scared that something will happen to her. So, but what we see is that the something happened magnified when she becomes a child bride with a baby and uneducated without means. Most of the marriages, just for the refugees, happen among refugees, statistically. And over 90% of these girls are without education, actually, and the same with the husbands. So we are building a generation that is not educated and has no hope for a future, a cycle of poverty. I want to end on a very positive note. Today is very important because it highlights these issues. Without us knowing where we are, what are the main challenges, we cannot address scenarios for the future. So this is very important, and I think progress has been made. The Nairobi Summit commitments are very important, and they give us guidelines, frameworks, similar with the Sustainable Development Goals. We have indicators. There is at least a way forward where we can move and measure it. Thank you.
Thank you so much, Dr. Abla. Thank you again, Dr. Ibrahim, and Dr. Salma for your kind contributions. Now, I believe the main message that we came out today from this UN talk is that, yes, together, hand by hand, we can overcome this crisis and support survivors of violence in Jordan and build back better and inclusive and sustainable society for all. So I will leave now the floor for journalists to ask questions to our speakers.
مساء الخير. أنا نادين نمري، صحفية من جريدة الغد. عندي 3 أسئلة. السؤال الأول، تفضل المشاركين المتحدثين عفوا، وقالوا إنه كان في مضاعفة لإدارة حماية الأسرة بتقديم خدماتها، كان في خطة وطنية، كان في فريق وطني، بس كمان تفضلت الدكتورة سلمى وقالت كان في استقبال للحالات، بس قد ايه كانت في بعدين المتابعة. سؤال، هل احنا حاليا عم نستنى من الجهات الحكومية توفر الخدمات سواء اجتماعيا، نفسيا، قانونيا بشكل أوسع، ولا تتيح المجال قدام مؤسسات المجتمع المدني إنها تشتغل بشكل أوسع، خصوصا مع ما يقال حاليا عن التضييق في التمويل لمؤسسات المجتمع المدني؟ هذا سؤالي الأول. السؤال الثاني، خلال سنة ونص من كورونا صار في تغيير في اتجاهات المجتمع الأردني، أصبح أكثر تقبلا لعمل الأطفال. بعد سنة ونص من الغياب عن التعليم، والسنة الجاي رح نرجع على المدارس، رح يكون في نوع من إذا بنقدر نحكي ممكن يكون في استغراب، ممكن فترة طويلة كان في انقطاع من التعليم. فهل في فكرة أو توجه معين كيف ممكن نحمي مزيد من الأطفال من التسرب من المدرسة حتى لا يكونوا ضحايا للزواج المبكر أو عمل الأطفال، لأنه بنعرف أنه التسرب من المدرسة هو سبب رئيسي للزواج الأطفال. أخيرا، مع بداية التعافي الصحي من موضوع COVID-19، إيش هي الرسالة اللي ممكن توصلوها للUN؟ يعني إيش هو نوع الدعم أو المساعدة من منظمات الأمم المتحدة للأردن في موضوع التعافي من كورونا؟ شكرا، أو آسفة للإطالة.
Translation? Oh, okay.
There were three questions. The first one was related to the role of the government versus the role of the civil society in Jordan, and whether the role of the government should take and do everything, or the civil society is also have roles there. What do you think? The second question was related to during the pandemic, we witnessed an increase of child labor and dropout from schools, even virtually. So what would happen when the schools come back again next September? For sure, we might witness higher rates of dropout from schools, which will lead to higher rates of early marriage. So what are the suggestions there? And the third question was related to what type of, now after we're getting into the resilience phase after the pandemic, what is the type of the support that we need from the UN agencies and donors? So these are the three questions. نبدأ نجاوب. أنا حجاوب على بعضهم. كمل طيب. يعني let me first highlight that the role of the UN agencies and the role of the donors, even during the pandemic and before and after, have never stopped. And yes, there are talks about a decrease in the amount of funds, but at the same time, the support is there, and the UN agencies, and in specific the UNFPA, is putting huge efforts and more efforts in making sure that the funds are going to the most vulnerable and to the needs, the highest needs there when it comes to GBV and SRH issues. So this is basically for the fund. Now, the role of civil society will never be absent. It was there from the early beginning of the pandemic. Yes, at the beginning, the first month of the lockdown, the role of the government was increasingly taking over everything. But after the first month, the civil society again came back and provided the services. And even during the lockdown, there were huge coordination, even between the civil society organization and the government. And with the support of the donors and the UN agencies, and in specific for us, like the UNFPA and the UNHCR, we were able to reach out to all the cases and all the beneficiaries who are in need, and especially women and girls in need when it comes to GBV. Now, when it comes to the child labor and dropout from schools, I think this is a real issue, and we're expecting it. And I think there should be, from now, some actions that should be taken from the civil society and from the government to make sure that when the new year comes, when the new academic year comes, there should be huge efforts from everyone to make sure that the students are getting back to schools. And it will be a challenge, for sure. It will be a challenge. I want to leave the floor also for my colleagues, Dr. Salman.
I just want to give you a bit of numbers in terms of child labor. In what we had, this is the latest we had on that as statistics, and that's pre the pandemic. It was in 2016, about 11.7% of the kids were in child labor. So you can imagine after COVID how the numbers have been magnified. أنا لازم أحكي عربي صح؟ Okay. In terms of kids working in dangerous occupations, we had about 586 girls between the age of 5 and 11, and 687 girls between the age of 12 and 14. So you can see these numbers as before the crisis. Now, my main worry regarding that, the children have been out of school. What families' income levels have dropped so much. During that time, they had to make ends meet, and they had to depend on their children to start the shop or whatever. Now, the economic situation did not change. It may have worsened. So what would compel families to send their kids to school if there's still, the economic need is still there? So there has to be concerted effort from everybody, government, non-governmental organizations, donors, the UN agencies. One, to push for the compulsory education for those under the age of 18, that it's a must, and that there has to be stricter mechanisms for monitoring that families are sending their children to school. And thirdly, compliance with the ILO conventions that Jordan has signed on in terms of child labor. So these are very, very important. The role the UN can do and what the UN agencies can do, really, we are very proud of the relationship of the various governmental and non-governmental agencies with the UN agencies. And one of that is what we saw during the response to the COVID, is that UN agencies shifted their priorities to match national priorities and shifted their programming focus to address the crisis, to address the needs of the various population segments. So, and we saw that across the various UN agencies. We saw their support to the government in trying to respond, whether it's the Syria crisis response, whether it's response to the various aspects of the impact of the COVID. I think continuing to work jointly with the government and non-governmental organizations and the private sector in redefining priorities as we move now, because we are not sure yet, and this is a big debate, did we move back to a humanitarian crisis, but it's no longer affecting just the refugees, but the entire population? And where do we stand in the nexus from humanitarian to development and vice versa? Thank you.
Thank you, Nadine, for all the important questions. I think that we cannot afford at this point to expect that the government will be doing all the work for GBV response alone. And the experience in the entire world is that this is not only a job of the government. We know that civil society organizations, in terms of service provision, specifically with protection, play an important role, especially in a country where our instructions and procedures in the government are not up to international standards. Women who go to shelters that are in the government are separated from their children. They are unable, they do not have their freedom. The treatment sometimes is more of, as I said, that she has to be returned to her parents or husband as if she's the ownership. So we need the other services that are provided by civil society. And I had put a circle that I forgot to mention, the issue of approvals of funding. Now we all agree, we all understand, and now even government organizations, all of us, we need approvals for fundings. The problem is how the procedure is being carried out. There is no clear criteria. When is the rejection happened? How long should we wait before we get the approval? And if the problem is that the procedures are not clear. We all agree that we need transparency. We need accountability. We all need to have the right procedures in spending. We don't want the funding that comes from the donors get lost or mismanaged or duplications. We know that there are many issues to deal with. But unfortunately, the procedure is not even dealing with these issues. We see that this is not, the solutions are not that. For example, how much the programs are responding to the national women's strategy. Sometimes we find that some programs that are responding directly to the national women's strategy are refused without clear explanations. When it comes to GBV, they keep complaining that we do not have enough resources for GBV, yet projects with organizations that have long history, like, for example, the Women Union, of carrying out excellent services to survivors, yet it takes a long time. Sometimes the funding gets lost. So yes, we need to improve our procedures for approvals, and we need to increase dialogue between the civil society and the government to have better transparency, build confidence, ensure that our procedures are seamless, are working together and aligned, so we are all working towards the same national goal. It's not something that is going, and to allow discrediting of the civil society who are helping women and girls who are subject to gender-based violence is not helpful to the government itself. So why do they leave this language going on without clarifying that actually they do have these partnerships with the civil society, that they know the fund, where is the funding going, is unclear to us. So, so this is very important. Regarding I am very worried about what is going on with children, boys and girls in Jordan. I do not see any serious work on making up for the lost loss of quality of education. We know that some children did not get any education. We know we will be suffering from increased inequality in the quality of education. We know that some students have managed to, many students will need to catch up, and we're not clear how quickly is the government going to be working on this. Some students still today do not have tablets. Some students still today do not have internet services. So I don't know what we are expecting. And again, no clear dialogue with civil society organizations, campaigns that are working towards the issue of education, nothing. It's like the government is talking to itself, and this is something that I want to bring to the UN. We hear about the UN having discussions with the government on issues of education. We hear that they are having discussions when we talk about high-level ministers on GBV, and at the same time, the UN comes and talks to us. Why isn't there an open discussion? Sometimes we hear rumors that this UN organization heard that the government is planning to do this. Why? We are the national stakeholders. Why aren't we sitting on the same table having discussions together on this? So this is very important. We need to have an open discussion on our challenges. It's a real challenge. I don't expect those who dropped out to come back, as Dr. Abla said, whether as child who have already gone to child labor. It was the adaptive measures of the governments, and this brings me to the social protection strategy. I've been talking about the social protection strategy, that has not taken gender issues enough when it was designed. Today now we started working on it. We are they have started working on the different themes, but it needs real revision because gender is not taken into consideration, and I'm worried because it is not about charity. We have seen an increase in charity work in Jordan in the past year, but where is the institutional government work ensuring that people in time of crisis do not have to revert to negative adaptive measures to deal with their poverty? The numbers of poverty till today are not the right numbers. So this is very important that we need to work on, and we need to have the dialogue with all the partners at the same time, not bilateral here, bilateral there. Thank you.
Thank you so much, Dr. Salma. Thank you, Dr. Ibrahim and Dr. Abla once again. Well, we reached the end of today's UN Talk. Thank you to all participants who joined us virtually, and we hope you enjoyed today's discussion. Have a good evening, and we hope to see you in the upcoming UN Talks. Okay. One more question. Okay.
أحكام الدجال موقع سوريف الإخباري. دائما في هيك جلسات ونقاشات بننسى المرأة الغارمة في الأردن، وهذه قضية كثير أنا اشتغلت عليها ومهتمة فيها. بعد ما ينتهي قانون الدفاع رح مهددات حوالي أكثر من 20,000 امرأة في السجن بسبب عدم سداد القروض، والتسهيلات المقدمة للمرأة في الأردن كثير سهلة، يعني ممكن بس هوية وكفيل رجل تاخذ قرض وهلأ بسبب الجائحة ما قدرت تسد. دوركم كمؤسسات مجتمع مدني وبهمني كثير كثير انه الجانب الثاني اللي بدي اسال عنه اللي هو قد يطلع من هاي القاعه ونلاقي جريمه قتل. احنا جريمه القتل كثير زادت في الفتره الاخيره على نساء، فانا يعني مش مع حل انه ماذا سنفعل في المستقبل، ايش نعمل هلا؟
I'm going to answer in Arabic, so if you want to use the translation. أول شيء طبعاً قضية الغارمات في جانب مؤسسي وطويل الأمد، وفي جانب حقاني، وإحنا بنعرف كمان اليوم إنه كل المشاريع الصغيرة والمتناهية الصغر المملوكة من نساء وحتى من رجال، بس من نساء عم بتعاني كتير من هذا الموضوع. اللجنة الوطنية من شهر 5/2020 من بدايته وهي عمالها بتطالب لأنه بدنا حل آني. أول إشي بوجود صندوق لدعم النساء المتعثرات، خاصة صاحبات المشاريع، سواء صاحبات مدارس، سواء حضانات، رياض أطفال، لأنه مش كل المدارس الخاصة في الأردن هم ال10 مدارس اللي في عمان الغربية، هدول كلهم بيقدموا خدمات في المحافظات في المناطق المهمشة، وهدول بيدفعوا شهري. تم بصندوق همة وطن بعض المساعدة لرياض الأطفال، وجهوا بعض المبالغ رياض الأطفال لكنها غير كافية. فنحن اليوم للأسف في قضايا الواقع القديم لواقع كيف كانت تعطى القروض، تحديات كبيرة يجب العمل عليها، بس في المقابل بحاجة لحل آني حتى نقدر نشتغل على النساء اللي هلأ تعثروا والمؤسسات متناهية الصغر، آخذين بعين الاعتبار إنه مش كل القروض الصغيرة متناهية الصغر قدمت بطريقة صحيحة. بنعرف الاستغلال اللي عماله بيصير، بنعرف في الاستغلال بداخل الأسرة بسبب علاقات القوى، والاستغلال بالمنظومة الرأسمالية اللي بتروح للمرأة الفقيرة، للمرأة المقطوعة بدها تدفع كهرباء، وعارفين كل هاي القضايا. عشان هيك اللجنة الوطنية لما كانت اجت خطة مشروع المشرق للبنك الدولي عشان تمكين المرأة الاقتصادي، واقترحت رفع المخصصات للمشاريع المتناهية الصغر للتمويل، قلنا ما بدنا يكون هذا جزء من الخطة إلا بعد ما يتم إجراء دراسة لآليات التمويل التي تقدم وشكل الوصول لهذا. والآن هاي الدراسة عمالها بتنعمل، اللجنة الوطنية عمالها بتحاول إنها تضمن بأنه هاي الدراسة تتابع كل عملية البدء من النشر عن التمويل أو الإعلان عنه لحدية الحصول عليه والفوائد وما إلى ذلك. طبعا بدنا نتذكر أنه في بس 10 مؤسسات داخلة تحت تنظيم البنك المركزي، وفي مؤسسات للآن مفروض من هون لنهاية السنة تنظم نفسها، لأنها موجودة تحت مسجلة لدى مراقب الشركات، ولكن لا تتبع لتنظيم المنظومة تبعت البنك المركزي. فالقضية ما بنقدر إحنا نحلها، اللي شايفيتنا قاعدين هون لا يمكن أن نستطيع أن نقدم حلول لا آنية الآن ولا تشريعية بدون ما على أعلى مستويات صنع القرار يكون في قرار، خاصة طبعا مثلا في التشريع بالنسبة لقانون التنفيذ. إحنا لكن حتى قانون التنفيذ ما بتقدر تطبقيه على السابقين، لأنه أنت في عندك حقوق لمؤسسات أعطت هاي القروض، وهاي على فكرة المؤسسات التمويل هي بتكون ماخذة قرض من البنوك كمان، ما تفكري إنها هي ماخذة يعني كله جايها ببلاش. فهاي ممكن تؤدي ل بسموه دومينو إفكت على هذا الموضوع. فلازم يندرس بشكل كبير، وللأسف بقدر أقول لك إنه نحن اللي موجودين هون الثلاثة مستحيل إنه نقدر نساهم بحل بدون ما يكون كل الشركاء بما في ذلك الحكومة عمالها بتفكر بحلول استراتيجية بالإضافة للحلول المباشرة والآنية، واللي فعلا تم المحاولة سواء صندوق الزكاة أو غيره. يعني ما في طريقة تانية نحلها، لأنه بالنهاية لازم يعني القضية صعب إنك ما تحليها بطريقة مختلفة. بالنسبة للقتل يعني للأسف اليوم أنا بدي أقول لك اليوم بالأردن، وهذا ما ذكرته لأنه كان بديش أخذ وقت كتير، نحن عم نعمل دراسة الآن اللجنة الوطنية عن جميع قرارات المحاكم الموجودة على سيستم القسطاس في آخر 10 سنوات لكل جرائم قتل النساء، عشان نطلع شو كان أثر التعديلات التشريعية، شو كان أثر الحملات ودور المجتمع المدني في الضغط وحتى على المستوى الشعبي، هل أثر فعلا في إنه يصير في تشديد. لأنه بالنهاية بدي أقول لكم إسقاط الحق الشخصي مثلا في جرائم الواقع داخل الأسرة بما في ذلك القتل هي يعني لا تعني تحصيل حاصل إنه يحصل على تخفيض في الحكم، وبدأ يظهر اتجاه قضائي إنه القضاة، لأنه بالآخر هاي بترجع لإلهم، إنه ما يأخذ بإسقاط الحق الشخصي مجرد إنه أخذته إنه ينزلها لنص سنة. وعشان هيك هلأ عمالنا بنوثق. أنا بعتقد كل ما صار المزيد من الأحكام الجادة اللي ما بتخرج المجرم بسهولة من السجن، كل ما رح نقدر نوصل لمرحلة من إنه ننهي يعني نبتعد عن جرائم القتل. بدي أذكر أنا طبعا بالنسبة لي قتل واحد فقط يعني مرفوض في الأردن، لكن بدي أذكر إنه أرقام قتل النساء في الأردن يعني بالمقابل مثلا تطلعي بفرنسا القتل من قبل الشريك كتير أعلى من الأردن. لكن بضل السؤال، هل في منظومة مجتمعية تبرر؟ وبالتالي ما هو دور الإعلام والدولة والتعليم وغيره بأنه ما تسمح لمجال إنه نتساءل إنه ليش انقتلت، لأنه ما بصيرش تنقتل بغض النظر. والسؤال الثاني، هل منظومتنا التشريعية عمالها بتقدر تكون مستجيبة وسريعا، والقضائية تكون متشددة في التعامل معها؟ لأنه بالنتيجة نحن ما بدي أحكي إنه لدينا ظاهرة، لا ما بصير، حرام يعني نظلم البلد يعني هاي موجودة في كل العالم، بأمريكا اللاتينية الأرقام مرعبة، الأرقام مرعبة. فبس بدي أقول وحدة ما بسمح إنها تموت ولن أقبل. ولكن برضو السؤال الأهم، قديه نحن عمالنا بنسمح بالإعلام بهيك خطاب مبرر، مواقع التواصل والمنظومة القضائية قديه عمالها بتصبح أكثر تشدداً في قراراتها في هذه الجرائم.
Thank you so much, Dr. Salma, once again. Well, we reached the end of today's UN Talk. Thank you to all the participants who joined us virtually. We hope you enjoyed today's discussion. Have a good evening, and we hope to see you in the upcoming UN Talks. Bye-bye, everyone.